My name is Verena Bruno. I'm the Gender-Based Violence in Emergencies Specialist with UNFPA, and I'm here based in Antigua, deployed as part of the Surge team, that is a global team for UNFPA, to assist and support UNFPA Caribbean with the response to Hurricane Irma. Hurricane Irma affected various islands in the Eastern Caribbean, including Antigua and Barbuda, Turks and Caicos, St. Martin, British Virgin Islands, and we are assisting as a team the various islands in the two main areas that UNFPA mandate is focusing, which is gender-based violence and sexual and reproductive health. For the gender-based violence component, we are actually assisting the Directorate of Gender Affairs in Antigua, which is part of the Social Transformation Ministry, to make sure that gender-based violence response and prevention in emergencies is implemented. And we are focusing on three main interventions for this. The first one is to make sure that the referral pathway for the multi-sectoral services for gender-based violence survivors is in place, is strengthened. And we also want to make sure that the survivors can access the services through dissemination of the information where they can find the services. And when we talk of the services, we are looking at the medical services, the psychosocial support, the legal and security services. The second intervention is to do with the capacity building. So we are guided by the Interagency Standard Committee guidelines for mainstreaming GBV in the various sectors active in any emergency. And we have been conducting trainings, for instance, for the shelters managers, and we are here today in one of them, just to make sure that the people working in the emergency are aware of what is gender-based violence, are aware of the services as well, and are able to refer the people to the so-called specialized service providers. We are planning to do the same in the health department and in the security department. We're going to train the people that are part of security companies, police, as well as doctors, nurses, all with one purpose of sharing the information about gender-based violence and the services. And we are also looking at the shifting of the emergency to the recovery phase, and that will be when the people will start moving from Antigua to Barbuda. And of course, we need to make sure the same information is disseminated, the same services are available back in Barbuda. As part of the mitigation strategy for gender-based violence, we have been distributing, and we're still distributing, dignity kits, which are one of the minimum standards for UNFPA response. These are kits that include some toiletries, sanitary pads, underwear, and other items targeting mainly women and girls, to make sure that the risk of exposure to gender-based violence in an emergency like this is reduced. I visited Barbuda beginning of November 2017 to conduct an assessment on safety and possible exposure to gender-based violence. What I've seen is that the island is still not ready for the people to move back, and the reason is the basic services are not back in place yet. There is no running water, there is no electricity, the houses are not been fixed yet. There was not many people there, but of course the safety risks for any people starting to go back now to clean or to rebuild the houses are there. There is very little security on the island. The houses are open, you can walk in, and there are animals like stray dogs and pigs and any other kind of animal that, you know, can become also dangerous because they are not being fed properly. And we've been discussing in the coordination meetings that we held regularly with the NOTS, the National Office of Disaster Risk and Services in Antigua, all of these issues, and we're working very well together to make sure that once the people moves back in Barbuda, all of this will be addressed, have to be addressed, to make sure people is not exposed to any form of violence.